There are two kinds of medicines for asthma. Doctors may give you one or both kinds, and both medicines are commonly used through an inhaler. There are differences between the two, so avoid mixing them up. The long-term controller helps to cut down on inflammation, swelling, and the buildup of mucus in the airways of the lungs. It helps make asthma attacks or flare-ups less common, and this kind of medicine needs to be taken regularly, even when you feel well. Now, for the quick reliever, also known as rescue medicine, this helps relieve or stop asthma symptoms during a flare-up, so it's important to use it as soon as your symptoms begin. It can also help you prevent a flare-up by using it before an activity, like exercise, and most quick relief medicines work within 15 minutes and last for up to 4 hours. It is key to take your medicines exactly as prescribed, which means taking the right medicine at the right time. Now let's focus a bit more on rescue inhalers and inhaled steroids. Rescue inhalers are quick-acting medicines that help relax the muscles around the airways. This allows for more air to move in and out of the lungs so that you can breathe easier. Common names for rescue inhalers are albuterol, metoprolol, levalbuterol, and berbuterol. Once you start noticing the first signs of an asthma attack, follow the directions on your asthma action plan. Get immediate medical treatment if your quick-acting inhaler does not give you relief for at least 4 hours or does not improve your symptoms. Inhaled steroids are asthma medicines that help make the airways less sensitive to asthma triggers. They reduce swelling and clear mucus from inside the airways. Common names for inhaled steroids are Qvar, Flovent, Pulmicort, Dulera, and Symbicort. They are safe when used as prescribed and with proper technique. One of the side effects of taking inhaled steroids is getting a yeast infection, also known as thrush, inside the mouth. To help avoid an infection, use a spacer with an inhaler. Rinse out your mouth with water immediately after each use of the inhaler. This helps make sure no medicine is left as residue inside the mouth. Here are some common questions that may be asked about inhaled steroids. Is this the same steroid athletes use? It is not the same type of steroid that athletes use to build muscle or bulk up. Athletes may, however, use inhaled steroids to breathe easier to perform a sport. Will inhaled steroids affect my child's growth? Current research shows that the benefits outweigh the risk of inhaled steroids. Asthma that is not under control can slow a child's growth. Can I become addicted to inhaled steroids? Inhaled steroids are not addictive. The thing to remember is that they must be used as prescribed to get the full benefit. Now let's talk about the proper use of spacers with inhalers. To get the full benefit of inhaled asthma medicine, they need to reach deep into your lungs. The use of a meter-dose inhaler and spacer can help with this. A meter-dose inhaler holds asthma medicine. It sprays large and small bits of medicine quite fast. A meter-dose inhaler is often used with a spacer. Now, a spacer is a tube that helps the medicine get from the inhaler to your lungs. A few things may happen when not using a spacer. Without a spacer, most of the medicine gets on the tongue, back of the throat, or even the face. Large bits of medicine are too heavy to make it down into the airways, and they end up in the mouth and go into the stomach instead of the airways. By using an inhaler with a spacer, you are more likely to get the medicine into the small airways. To use a meter-dose inhaler correctly, follow these tips. Test a new inhaler or one that has not been used in a week. Spray 4 sprays into the air before using it. It is also important to keep in mind that spacers should never be shared and should be cleaned often. To clean a spacer, remove the inhaler from the spacer. Do not wash the inhaler. Wash the spacer with warm soapy water and rinse, and then air dry the spacer. To use a spacer with a mask for children under 5 years old, follow these steps. Shake the inhaler 10 times. Insert the inhaler into the spacer. Place the mask over the child's nose and mouth. Count slowly to 5 and then remove the mask. Wait at least 1 minute before a second puff, if needed. Older children, teens, and adults should shake the inhaler 10 times. Insert the inhaler into the spacer. Breathe out. Place the mouthpiece of the holding chamber between your teeth and above your tongue and close your lips around it. Press down on the meter dose inhaler once and then slowly take a deep breath in.
Using a metered dose inhaler. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Without the inhaler, take a breath and breathe out all the way. Hold the inhaler upright. Put the inhaler in your mouth, above your tongue, and between your teeth. Seal your lips around the inhaler. Begin to breathe in slowly. Press down on the inhaler 1 time and keep breathing in. Hold your breath for 5 to 10 seconds. Open your mouth and breathe out slowly.
How to use a metered dose inhaler with a spacer. This video is brought to you by the American Lung Association. Make sure the inhaler and spacer are free of foreign objects. Shake the inhaler for 10 seconds to mix the medicine and remove the cap from the mouthpiece. Place the inhaler mouthpiece onto the end of the spacer. Hold the inhaler between your index finger and thumb. Stand up and take a deep breath in. Then breathe out as much as you can. Put the end of the spacer into your mouth between your teeth and above your tongue. Close your lips around the spacer. Press down on the inhaler to release the spray and begin to breathe in through your mouth. Breathe in deeply and slowly for about 5 seconds to pull the medicine deep into your lungs. If the spacer makes a whistling sound, you inhale too quickly. Hold your breath for 5 to 10 seconds or as long as you comfortably can with your mouth closed. Breathe out slowly through your mouth. If you breathe out too quickly, the medicine will not settle into your lungs. Wait 1 minute before taking a second puff as directed by your healthcare provider. Repeat these steps if taking a second puff. Rinse your mouth out with water and spit. Thank you for viewing this video from the American Lung Association.
How to use your discus. Now, a discus is the most common type of dry.
How to use a discus. This video is brought to you by the American Lung Association. Hold the discus flat in one hand and put the thumb of your other hand on the thumb grip. Push your thumb away from you as far as it will go until you hear a click. Hold the discus level like you are about to take a bite of a hamburger. Slide the lever away from you as far as it will go until it clicks. Turn your head away from the discus. Take a deep breath in and breathe out. Seal your lips around the mouthpiece. Breathe in deep and steady through your mouth. Hold your breath for 5 to 10 seconds or for as long as you comfortably can with your mouth closed. Breathe out slowly through your mouth. Rinse your mouth with water and spit it out. Thank you for viewing this video from the American Lung Association.
Here are a few ways Contra Costa Health Plan can help. Check out our health education website, which offers a wide range of topics, resources, and self-management tools. Just visit healthed.cchealth.org. Contra Costa Health Plan also offers a CalAIM asthma home remediation program. This program provides help and supplies to people who are dealing with asthma-related issues. You may get a home assessment and some minor fixes to help with asthma triggers in your home. You may get things like ventilation improvements in your home, air filters, dehumidifiers, and filtered vacuum cleaners. So what you can do is you can talk to your primary care provider, your case manager, or other healthcare professional about a referral. You or your caregiver can also call member services at 877-661-6230 under option 2. And member services are available Monday through Friday from 8 in the morning to 5 in the afternoon.